Hi, my name's Jo. I'm a midwife and my daughter was diagnosed with epilepsy in 2013. I've been using the virtual clinics for transition and information. I'm a busy mum and so I also need a lot more time to try and get to the consultant appointments at the hospital. So doing it online, face to face, gives me a chance to discuss eating seizure control and any problems even having even at school, and then Liz helps us with all of that. So it's been brilliant for me and my daughter because we've been able to discuss seizure control face to face without having to go to the hospital and make an appointment. The virtual clinics work through a video computer link in the same way that you might speak to your friends on the computer. They are really relaxed. I can see the nurse on my computer screen and talk to her at the time and date that suits me and my daughter. I don't have to go to the clinic. It really saves us a lot of time and it's very easy to set up. We had to make sure we had a secure place for the conversations. My daughter could do this in her own home in her bedroom, or if needed, if I was at work, we could do it at a private place. I had to make sure I had the right computer equipment for the virtual video conversations with the correct security in place, and I was able to get help with this. If I was worried at any time that I was overheard, I could stop the session, and this made me feel that I was in control. This information is stored on the computer and will include your contact numbers and information about your health and care, including any results of medical investigations you have had. It may also include information other organisations involved in your care, such as your doctor, school or hospital. It's all the information that will help people treating you to do their jobs well and get the best results for you.
I've used the virtual clinic a couple of times. It's a great idea because it's allowed me to not have to take time off of work, and it's been able to fit in around my daily routine, around my little girl, not having to go to the hospital for appointments, which was a real bonus for me. During the virtual clinics, I've been able to talk to Liz about increase of seizures that my little girl's having, and upping her medicines, and we've also done referrals. We also have clinic appointments where we see my little girl's consultant, but between those appointments, virtual clinics are a really, really good help to us because we are able to discuss issues that we have there and then rather than have to wait to go and see the consultant at the next clinic appointment.
So now you have an idea of how this works, we are going to tell you a little bit about what sort of information will be collected about you through the virtual clinics and how it will be used and why it's so important.
The Children's Epilepsy Nursing Service helps all young people who have been diagnosed with epilepsy up until they transfer over to the adult services at 18. The information you give them is kept on your record, and it helps the professionals give you advice on the best care for you.
This information is stored on the computer and will include your contact numbers and information about your health and care, including any results of medical investigations you have had. It may also include information other organisations involved in your care, such as your doctor, school or hospital. It's all the information that will help people treating you to do their jobs well and get the best results for you.
Sometimes this information is used to help improve healthcare services across the region, to help with training staff or for research to develop new services. If your information is used in this way, it will never include any details about who you are or where you live, and you will always be asked for your permission if your information was needed for anything else. You can be absolutely sure that your information will only be passed to people involved in your care who have a genuine need to know it and who will apply the same levels of confidentiality and security. So if you think that these virtual clinics could help you, save you time and make it easier to attend your appointments, here's what happens next. You'll be asked to sign a form to say that you are happy to take part in the virtual clinics and for the Epilepsy Nursing Service to contact you using the virtual software. It's as easy as that, and you'll be able to have your appointments in a time and place to suit you while you get on with your life.